So again, anybody that wants to look more into the perimenopause can go back and look at my other talk. The symptoms of menopause are very, very similar. So in menopause, we're at the stage where a woman's periods have stopped. That's typically in and around the age of 51. Now, most people will have gone through their menopause within about 4 years. For some women though, it can actually last longer, and the current NICE guidelines when we treat women who require treatment for their menopausal symptoms are that there is no upper age limit. So we will occasionally see women who are receiving HRT treatment over the age of 60. It's less common, but you will see it. So there are a number of things that will happen to a woman during menopause. The most obvious is there will be no more periods or menses, so therefore the childbearing years for that woman are finished. Also, typically women experience things such as night sweats, hot flushes, low mood, anxiety, depression, urinary tract infections, palpitations, itchy skin. There's a huge list. I think the last time I checked there was something like 30 symptoms of menopause. Now, not all women will experience all those things, but it will be very individual for all women. About 20% of women have no menopausal symptoms whatsoever, and the large number of women will have some symptoms but manage to get through all their menopausal years without the need of medication. I tried to do some research to establish how many women were taking HRT, and unfortunately the information really isn't out there yet. So we do know, however, that since those two trials were published in 2002 and 2003, there are a lot less women taking HRT. Now, I'm not advocating that every woman should go out and take HRT. It's very much an individual thing. What one woman feels they can cope with, another woman may not. So what I would say is, if your symptoms of menopause are very detrimental and causing you great distress, then I would go and speak with your GP. There are other things than medication that we can do. But I think it's very important that women realise that it's not a given that when you go through menopause you must start HRT. HRT does have side effects, and none of the recent guidance has indicated that healthcare professionals should be starting women on HRT.